HME has spent 2 decades designing products and creating a software platform for the health monitoring of people from home. The transition required for home monitoring to be successful requires the patient to take responsibility for their health maintenance, and the medical professionals must also participate in the industry change from reactive to preventative health. Self-insured employers were the first to embrace preventative health care. Even though the managed care division of our company was small, we continued to develop and expand, knowing that this is the future of health. COVID made changes to the healthcare home monitoring market in 12 months that traditionally would take a decade or more to accomplish. Because of our 20 years of engagement of home monitoring industry, we have made drastic improvements with our products and software platform that most of the industry are not yet aware of. The Smart Health software platform was approved by Medicare in 2013 to be a part of the Diabetic National Mail Order bid that took place in the USA, which included millions of patients monitoring their diabetes remotely from home and storing the data in our server. HME has the solution, seasoned support center, and home monitoring equipment that no one on earth can offer at this moment of time. Remote patient monitoring with the acronym of RPM, offered by Medicare and embraced by Medicaid and private insurances, is driving the market. The doctors are reimbursed to support RPM and penalized if they don't. The balance of the world is taking a similar approach. RPM was once considered an option but is now considered a necessity on multiple levels. Diabetes, hypertension, heart disease, medication adherence, and weight management can now be managed with the patient participation. HME infrastructure is built for the patient's ease of use and seamlessly transmit the test results cellularly to the health cloud for storage. Our artificial intelligence electronic nurse will monitor the test results and detect trends. The patient and family members and healthcare professionals will be notified of the trends, good or bad. Key points of interest is our software platform, ease of use for the patient and healthcare professional. Our support center is capable of remotely viewing the patient and helping them, or we can do it for the patient as they watch us. The cell phone app has the same support capabilities as the healthcare platform. We can watch the patient, or the patient can watch us. The home monitoring equipment manufactured by HME and Clovis for the RPM market consists of 9 items. Item 1 is the medication adherence pill dispenser. It will monitor when and if the medication was taken, then transmit the data to the health cloud for the electronic nurse to remind the patient to take the medication or document the results when it was taken. Item 2 is the body and ear thermometer. It will record your temperature and transmit it to the health cloud through the personal cell phone app or the cellular gateway. Item 3 is the finger pulse oximeter. It will record pulse and oxygen level in the blood and transmit the readings to the health cloud through the personal cell phone or cellular gateway. Item 4 is the Smart Vital Watch that monitors multiple stats that include the temperature, pulse, blood oxygen level, blood pressure, EKG, sleep patterns, exercise, and mood swings. The data will be transmitted through the personal cell phone or the cellular gateway. Item 5 is the glucose monitor that transmits the test results through the personal cell phone or the cellular gateway. Item 6 is the standalone blood pressure monitor that can transmit the test results through the personal cell phone or the smart cellular gateway. Item 7 is the weight scale that can transmit to the health cloud by connecting to the personal cell phone, or the weight measurement will transmit seamlessly through the cellular gateway. Item 8 is the standalone EKG monitor that can connect to lead wires or handheld. The data will be transmitted to the health cloud through the personal cell phone or the cellular gateway. Item 9 is the cellular gateway that has Bluetooth capabilities and can upload any HME home monitoring devices through Bluetooth to cellular. The gateway can also transmit the other Bluetooth devices. Recently added products was the DR Watch, Dexcom continuous glucose monitoring, and Fitbit. We anticipate many other devices available in the industry to be added in the upcoming year. The collection of data that we can obtain from the patient's home is available to gather and transmit to the cloud 24 hours a day, 7 days a week, is traditionally not able to be collected without being in the hospital. In addition to this at-home monitoring module is the Focus module for remote wound care monitoring and the Transitional Care module created for the hospital. Focus Wound Care module is being promoted in Mexico and the Middle East this year, and the Transitional Care module is going live in the USA in September of this year. We recently finished a 2-year pilot with 4 major hospitals using our transitional care module, and all of them lowered their readmissions by 50% the first year and maintained the deduction for the second year. Savings millions from the reduction of hospitalization expense. Please contact info@clovisrpm.com for more information or to order samples.